There's a therapy out there that doesn't look like what most people imagine. You're not lying on a couch retelling your life story. You're following a therapist's finger with your eyes, or hearing alternating sounds, or tapping left and right. It almost seems too simple, but for many trauma survivors, this technique, known as EMDR therapy, has changed everything. So what exactly is it? And how can something as small as an eye movement lead to deep emotional healing? In this video, we're going to break down how EMDR works, why it's effective, and what you can expect if you try it yourself. So, what is EMDR therapy? EMDR stands for eye movement desensitization and reprocessing. It's a structured, evidence-based therapy developed in the late 1980s by psychologist Francine Shapiro. Unlike traditional talk therapy, EMDR focuses more on helping your brain reprocess the trauma. That's the key word, reprocessing. Trauma doesn't just live in your memories, it lives in your nervous system. EMDR helps your brain reorganize those traumatic memories in a way that's less emotionally intense, so they stop feeling like they're happening right now. When you go through something traumatic, a car crash, abuse, medical trauma, or a humiliating experience, your brain doesn't always store the memory properly. It fragments. The images, sounds, feelings, and body sensations get stuck in their raw form. That's why you might get triggered years later by a smell, a tone of voice, or even a place. Your body thinks the danger is still present. EMDR works by helping your brain complete the process it couldn't finish back then. It helps unstick the memory so it can be stored in a more peaceful, integrated way. There are 8 phases of EMDR therapy. EMDR is not just eye movement, it's an 8-phase process. Here's a simplified breakdown. Phase 1. History and planning. The therapist gets to know you, your symptoms, and helps identify target memories. Phase 2. Preparation. You learn grounding and relaxation tools to feel safe during sessions. Phase 3. Assessment. Together, you identify the image, negative belief, emotions, and body sensations connected to the memory. Phase 4. Desensitization. Here's where the eye movements, taps, or sounds come in. You focus on the memory while the therapist guides you through bilateral stimulation. Phase 5. Installation. You replace the old negative belief with a positive one. Phase 6. Body scan. You check for lingering tension or distress. Phase 7. Closure. You're guided back to emotional safety. Phase 8. Reevaluation. You revisit the memory later to see if it still holds emotional charge. It's a powerful and structured approach, and it's been studied for decades. You may be wondering why the eye movements? So what's with the eye movements? Why does that matter? Research suggests that bilateral stimulation, meaning stimulation that alternates between the left and right sides of the body, may mimic the natural processes that occur during REM sleep, when our brains process memories and emotions. During EMDR, as you recall distressing material while engaging in these left-right movements, your brain seems to digest the trauma in a more adaptive way. The emotional charge goes down. The memory remains. But it feels more distant, like something that happened then, not something you're reliving now. What EMDR feels like. Many people describe EMDR as emotionally intense, but surprisingly empowering. You might cry, you might feel discomfort as the memories arise, but you're not stuck in those feelings. Instead, the memory shifts, evolves. Sometimes new insights come up. Sometimes your body relaxes in a way it hasn't in years. Sessions usually last 60-90 minutes. You're in control the whole time. You can pause, slow down, or stop whenever you need to. And many people notice change in just a few sessions, especially with specific traumatic memories. It's not magic, but it can feel like something finally makes sense. So, what can EMDR help with? EMDR is widely recognized as one of the most effective treatments for post-traumatic stress disorder, but its benefits go far beyond PTSD. It's also used to treat anxiety and panic attacks, phobias, childhood trauma, medical-related trauma, sexual assault recovery, complicated grief, negative self-beliefs rooted in past emotional wounds. In fact, the World Health Organization and the American Psychiatric Association both recommend EMDR as a first-line treatment for trauma, when EMDR might not be a fit. While EMDR is powerful, it's not for everyone. If someone is currently in crisis, unstable, or without enough emotional support outside of sessions, EMDR might need to be postponed. Also, some people with complex trauma may need longer preparation phases before diving into desensitization. The key is to work with a licensed, trauma-informed EMDR therapist who knows how to pace things safely. Remember, it's okay to move slowly. Healing isn't a race. EMDR therapy is more than a trend. It's a bridge between the mind and body, a method that helps trauma survivors release what's been stuck for far too long. If you've ever wondered why talking about something hasn't been enough to heal it, EMDR might be what your brain and nervous system need. You don't have to keep reliving the pain. You can process it, move through it, and come out the other side with more clarity, peace, and freedom than you ever thought possible. If you found this video helpful, be sure to like, share, and subscribe for more mental health education videos.